You ever catch yourself like looking in the mirror and wondering, huh, have my eyes always been so prominent?
Happens to the best of us.
Right. So that happened to me recently, got me thinking, and I did a little digging into this whole bulging eye thing.
Oh, yeah?
Yeah, turns out there's a medical term for it, exophthalmos.
No, that's a mouthful.
Seriously. And apparently it's more common than you'd think,
It's true. Lots of things can cause it.
which is why we're doing a deep dive on it today. We'll break down the whys, the whats, and the what to dos about bulging eyes.
And maybe bust some myths along the way.
Exactly. Now, you've sent in some questions on this, so let's get into it. First off, is this just a cosmetic thing or
Either.
fatal?
That's where things get interesting. Bulging eyes, while they might seem purely visual, can actually signal something more serious going on.
Okay, so definitely not something to ignore then.
Not necessarily, but it's worth understanding. It all comes down to the optic nerve. It's like the messenger carrying signals from your eyes to your brain, essential for, well, seeing anything.
So, damage to the optic nerve, vision problem.
Exactly. And with bulging eyes, there's a risk of that nerve getting compressed, putting pressure on it.
Ah, I see where this is going.
And if it's not addressed, that compression can lead to some not-so-fun vision issues down the line.
Making this a potential sight saver, literally.
Hmm.
Now, you sent in some info about thyroid eye disease.
Oh.
What's the connection there?
That's a huge one, actually. Thyroid eye disease, sometimes called Graves' disease, is the most common culprit behind exophthalmos in adults.
Okay, two terms at once. Let's break it down. First, Graves' disease. What is it?
It's an autoimmune disorder. Basically, your immune system, which usually fights off the bad stuff, starts attacking healthy tissues. In this case, it attacks the muscles and tissues around the eyes.
Hence the bulging.
You got it. Think of it like this. Your eye is like a grape in a tiny cup, right? Graves causes inflammation, like that cup filling up with fluid. The grape, your eye has nowhere to go but out.
So the bulging is a side effect of the immune system going a bit off script.
Exactly. It's a symptom, not the disease itself, which is key to remember.
Okay, so mystery solved then, right? Exophthalmos equals Graves. End of story.
Not quite. While it's a common one, Graves isn't the only thing that can make those eyes pop.
Oh, I love a good medical mystery. What else could be at play? So spill the beans. What other sneaky culprits are out there making those eyes bulge?
Well, sometimes it's more straightforward than you might think.
Oh, like what?
Like an injury, for instance. Say you get a good whack to the eye. If there's bleeding behind the eye, it can push the eye forward. Like inflating a tiny balloon back there, you know?
Ouch. Okay, that makes sense. So injury, check. What else?
Sometimes it's the blood vessels themselves. If they're abnormally shaped, kind of like a kink in a garden hose, that can actually push the eye forward too.
So we're talking about like faulty plumbing, but in your eye. Not ideal. What else we got?
Infections, those soft tissues in the eye socket, they can get infected, and that can also displace the eye, make it bulge.
Okay, so injuries, weird blood vessels, infections. Anything else on our list of suspects here?
Well, we could get into some of the rarer diseases, but the last one I'll mention is probably one you've heard of, cancer.
Oh, wow. Okay, so even though it's not always the cause, bulging eyes could be a sign of something that serious.
It's true. And that's why even if it seems minor, not causing any pain or anything, anytime you notice changes in your body, it's always best to get it checked out, just in case.
Couldn't agree more. So say you're listening to this and thinking, maybe my eyes are looking a little different these days. What's the next step? What should you do?
Easy talk to your doctor. They can take a look, consider your medical history, all that good stuff, and figure out if more investigation is going to be.
Makes sense. So what does that further investigation look like when we're talking about eyes?
Often it starts pretty simply. A physical exam, the doctor will look at your eye movement, check for any redness, swelling. They'll even see how your eyelids are working, because bulging eyes can sometimes mess with that.
Okay, so nothing invasive right off the bat. But say they suspect it's more than just dry eyes or something. What then?
Then they might recommend some imaging, a CT scan, for example, that gives a really detailed 3D view of what's going on inside, so they can see the eyes and the surrounding tissues really clearly.
So they get a good look at what might be causing the bulging in the first place. What about blood tests? Are those part of the whole detective work here?
Definitely. Remember how we talked about thyroid eye disease? Blood tests can check those thyroid hormone levels, which can help confirm or rule out that diagnosis.
So much info from a little blood sample. It's amazing. Okay, so let's say they've done the tests, figured out the root cause. Then what? How do you even treat something like bulging eyes?
That's the million-dollar question.
Yeah.
And just like there's no single cause, there's no one-size-fits-all treatment. It all depends on what's causing it in the first place.
Makes sense. Okay, so let's walk through some of those options. Starting with the non-surgical route, what can you do if you want to avoid going under the knife?
Well, one of the simplest but most important things is quitting smoking.
Ah, good old-fashioned lifestyle changes.
Exactly. Smoking can make thyroid eye disease worse and make treatment less effective. So, yeah, ditch the cigarettes. Aside from that, there are things like artificial tears, for dryness and irritation, which are super common. Sunglasses, too.
Practical advice, love it.
Huh.
What if the bulging is causing problems with double vision? Can that be fixed without surgery?
Sometimes. There are special glasses with prisms in the lenses, and those can help correct double vision. Not a solution for everyone, but can be a game changer for some.
So we've got artificial tears, sunglasses, special glasses. Anything else in the non-surgical toolkit?
There are medications too. Corticosteroids, for example, they can help reduce inflammation. And then there's botulinum toxin injections, you probably know it as Botox.
Botox for bulging eyes. Never would have guessed. Seems like there are options for everything these days.
There are some exciting new treatments on the horizon too. There's a new medication specifically for thyroid eye disease, teprotumumab. It's showing a lot of promise.
Wow, a medication just for eye issues. That's incredible. But I have a feeling this is leading to a but, as in these treatments are great, but what if they don't work or the bulging is just too severe? What then?
You're right, there are situations where surgery might be necessary. Like if a tumor is causing the bulging, surgery would be needed to remove it.
To get to the root of the problem, literally, what about situations where it's not a tumor, but other treatments aren't working?
Well, in those cases, there's a procedure called decompression surgery. They basically make the eye socket a little bigger, create more space for everything, and that lets the eyes settle back into a more natural position.
So it's like giving those bulging eyes some breathing room. Makes sense.
Exactly. It's usually a last resort, but it can be super effective.
It's amazing what they can do these days, even for something like bulging eyes.
It really is. And it's not just about how it looks, it's about protecting your vision for the long haul.
Exactly, which is why catching it early is so important. So for anyone listening who's a little worried about their own eye situation, what's the key takeaway you want them to remember?
Honestly, if you take away just one thing, let it be this: don't ignore changes in your eyes. Even if it seems small, even if you think, oh, it's probably nothing, get it checked out.
Better safe than sorry, especially when it comes to your vision.
Exactly. It could be something super treatable, and catching it early can make all the difference.
Couldn't agree more. Well, this has been, wouldn't say eye-opening, since that's the whole topic.
Right.
But seriously, I've learned so much, and I hope you have too.
It's been great diving into this with you.
And remember, if you're ever unsure about something health-related, don't hesitate to reach out to a healthcare professional. They're there to help. And with that, we'll catch you next time for another deep dive. Until then, stay curious.